All right, we are going to talk about defects in homeostasis. So we need to stop the bleeding. Our representative condition for this will be hemophilia. Hemophilia is a deficiency in one of the factors necessary for coagulation of the blood. Factor 8 and factor 9 are the most common two. Factor 8 we see in the number has gone up to about 80% of all cases. The less they have of factor 8, the more severe the disease is. We diagnose hemophilia with a history of bleeding. We look at labs and we also look at the genetic piece of it. Hemophilia assessment. This is a sex-linked recessive trait. It occurs only in males. The major problem is bleeding. In newborn, we see abnormal bleeding from umbilical cord or prolonged bleeding from circumcision sites. In a toddler, we could see excessive bruising, prolonged bleeding from cuts and scratches. And in general, we see hemiarthrosis, which is bleeding around the joints, petechiae, epistaxis, and anemia. So what we need to do after we make this assessment is determine which clotting factor is deficient and the extent of that deficiency. Mild, they have 5 to 50% of the clotting factor. Moderate, 1 to 5%, and then severe is less than 1% of the clotting factors. Like I said, the most common is it's typically a factor 8 deficiency. Some of our nursing diagnoses that we work with here are risk for injury related to bleeding tendencies, pain related to hemiarthrosis, impaired physical mobility related to bleeding and pain, and then knowledge deficit related to home care and follow-up. Let's go back here. Oh, let me flip ahead a minute. I got my notes. Okay, good. All right, I'll go back to the labs. Sorry, guys. The labs here, again, in addition to looking at the clotting factors, let's look at the bleeding times, PT-INR, PTT, and what are the platelet counts. When we jump into the nursing care, our first goal is to prevent injury and possible bleeding and control bleeding episodes when they occur. So we want to make sure we're providing a safe environment. We look at toys without sharp edges, safety scissors, wear helmets and joint pads when playing actively, soft toothbrushes, avoid IMs and IVs if necessary, or at all times if we can. If necessary, if they need an IM or an IV, we would apply pressure to the site for at least 5 minutes after withdrawing the needle or inserting the IV. Don't use aspirin or medications containing aspirin. Local measures would be the direct application of pressure, and we can also use ice and immobilization. A systemic measure that would go system-wide is administer clotting factor 8. All right, some of our other nursing care, our goal is to control pain. We typically use NSAIDs for synovial pain, so that pain around the joints. But again, don't forget with NSAIDs, it does inhibit platelet function. We can also give corticosteroids for acute hemiarthrosis and or chronic issues with the joints. The other goal here is to prevent long-term disability related to the degeneration of the joints. We do that by keeping the joints immobilized for 24 to 48 hours, which allows blood to clot when it's bleeding into those joint spaces, and keeping it immobile will help prevent that clot from dislodging. After the acute phase, we can begin passive range of motion exercises. If they are going to physical therapy, we want to make sure we're medicating for pain prior, and make sure we're doing a prescribed exercise program for these patients to maximize joint function. We want to avoid prolonged immobility. We can use braces and splints. Well, we don't want to use braces and splints for long term because it can lead to permanent deformities and loss of mobility. Your last goal here is health teaching, promote independence and management of own care. We want to make sure we encourage the child to assume responsibilities for choosing safe activities. We want them to wear a medical alert bracelet so others know that they have hemophilia. From about the age of 9 to 12, the child can be taught to self-administer the clotting factor intravenously. Prior to that, the family is doing that at home. And then as the child enters adolescence, we need to discuss realistic vocations as well. Insurance coverage, genetic transmission. In addition, some of our other treatment we can do, I think we kind of talked about all of this. Replace the clotting factor, anti-inflammatory meds. We talked about not using aspirin. We would want to use Advil cautiously because it's an NSAID. We talked about regular exercise, PT. Home care, teach venipuncture, teach administration of the anti-hemophiliac factor. We talked about the medical alert bracelet, and just make sure they know what the signs and symptoms of bleeding looks like if it's not obvious. Abdominal pain, abdominal bloating could be bleeding into the abdomen. Joint pain, that could be indicative of bleeding around those joint spaces. LOC changes as they're bleeding in the brain. So make sure we're doing lots of teaching. Your evaluation or your outcome criteria is that serious injuries are prevented, pain is prevented, there are no long-term disabilities, and in the end, the child is able to manage their own care independently with minimal supervision. I do think I have some other home care issues that I want to, there we go, sorry. Some other home care things that we need to consider. We already talked about a soft bristle toothbrush, but shaving. Make sure they're using electric razors when they get older and they need to shave. Plan appropriate schedule of activities when we're talking about sports, no contact sports. Remember, swimming is always a good sport for almost any disease process that we talk about. We want to refer them to social services. This is a lifetime disease, lots and lots of money. There are support groups available for this patient population with hemophilia. Hospital care for patient with bleeding disorders. We want to make sure we're avoiding rectal temps and suppositories. You want to check their blood pressure as infrequently as possible. If the BP is normal and not an issue, we're not going to keep checking it every 4 hours. Think about all the pressure that blows up on that. As we inflate the cuff, all the pressure that's exerted on those vessels in the arm. We talked about avoiding subcutaneous IM medications. Hopefully we can avoid IV starts. If not, we're using pressure. Think about what type of tape you're using. Mouth care every 3 hours, glycerin swabs. If we do need, on an infant, if we need to do a blood test, venipuncture is preferred over finger or heel sticks. There's actually less bleeding from a venipuncture than there is with a finger or heel stick. Tylenol for pain is a good option. And then some potential stressors that we need to think about with hemophilia. We worry about AIDS if they are having transfusions. Although since about 1985, there's virtually no risk of AIDS with blood transfusions, but we still do think about it. We talked about no contact sports. We talk about this is a lifelong disorder. We talk about as these adolescents grow and become adults, they're faced with, do they bear children? Are they going to become a parent? We talked about their vocation and insurance. Currently right now, to manage hemophilia, it is about $100,000 per year. And the cost of those clotting factors is extremely expensive. So clotting factors, when you read throughout the chapter, there can be some controversy about them due to the cost, and the half-life of the clotting factors is only 10 to 12 hours. If you look on page 1287, they talk about in the, let's see, 1, 2, 3, in about the 4th paragraph on page 1287, when they talk about prophylactic therapy is periodic factor replacement for children. So you guys can kind of read about it in there as well. All right, I'm going to end this one, and then I'm going to click over to the next PowerPoint, and we will start our neoplastic disorders discussion.